بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد وعلى آله وصحبه أجمعين. I'd like to thank the nursing department for their active learning which discuss variety of disease, and today I think the lecture which is assigned to our department is shock. As everybody knows that shock is mean a clinical expression of circulatory failure which result in inadequate cellular oxygen utilization. Shock is a common condition in critical care, as we said before. It affects 1/3 of the patient in intensive care unit. Diagnosis of shock start with clinical, then hemodynamic and biochemical signs. But if you look to shock as in general, you will find also there is a drop in the blood pressure. That's what does it mean. Systolic blood pressure is low. The second, there is clinical signs of tissue hypoperfusion. Tissue hypoperfusion, which is usually present as a skin, which will be called cyanotic at the finger, which means low state of flow. Also, there is renal. It can be sign of shock, decreased urine output. If it is less than 0.5 ml per kilogram of body weight per hour. And there is a neurological manifestation, which is altered mental status, which is typical of tension, disorientation and confusion. Now, if you want to do differential diagnosis, of course, the most common type of shock is septic shock, which is common in ICU mainly, and then followed by cardiogenic shock, and by hypothermic shock, and lastly obstructive shock, which is relatively rare. The key factor in how to approach shock, patient in shock, is resuscitation. The most important is resuscitation. Give fluid to your patient. Start with fluid initially. There is a rule, usually they call it VIB rule of shock. VIB rule, this is V stand for ventilate or oxygenate, which is oxygen administration. I infuse, which is fluid resuscitation, and P pump, which is administration of vasoactive agent. So if we know that the problem of shock is oxygen, that decreased oxygen delivery to the vital organs, we believe now that we have to give good oxygenation, good resuscitation, so you help the cardiac output and oxygen delivery to the tissue. And giving one of the things regarding septic shock, we have to start in the first hour at least immediately antibiotics, broad coverage antibiotic to cover. This is specific for septic shock. In conclusion, circulatory shock associated with high morbidity and mortality. Early identification is essential, and aggressive management can be started. Appropriate therapy based on good understanding of the underlying pathophysiology mechanism, and treatment should include correction of the cause of the shock, hemodynamic stabilization, primarily through fluid infusion and administration of vasoactive agents. And I think this is what we can offer for shock. Of course, nursing monitoring is important when they are monitoring the patient in ICU. And thank you very much.